Deep vein thrombosis. It is an acute thrombosis of deep vein, and the risk factors for DVT are varicose triad, which constitutes endothelial injury, stasis, or hypercoagulable state, which is the predominant risk factor. It can be inherited or acquired. Inherited factors are protein C deficiency, protein S deficiency, and antithrombin 3 deficiency, and acquired factors are prolonged immobilization, obesity, and any major surgery. Then the surgeries which are mainly responsible for deep vein thrombosis are any major pelvic or abdominal surgery, orthopedic surgery around hip joint, or urological surgery in more than 40 years of age. Therefore, we give them DVT prophylaxis, which can be mechanical or pharmacological. The mechanical prophylaxis include early mobilization of the patient. Then we give pneumatic compression devices to the patient. We give sequential compression devices to the patient. And in pharmacological therapy prophylaxis, we give unfractionated heparin to the patient or low molecular weight heparin to the patient. The most common site for the DVT is the calf vein or soleal vein, and the most common site of DVT leading to pulmonary embolism is the femoropopliteal vein. The clinical features are swelling and pain in the calf region, calf tenderness, and it is usually unilateral. Then DVT may leads to pulmonary embolism and cause sudden death of the patient. Therefore, the clinical features of the patient with pulmonary embolism are pleuritic chest pain, dyspnea, and hemoptysis. And the signs of DVT are calf tenderness, then edema, which is pitting initially, later on becomes non-pitting, and tenderness along the course of the vein. We have Homan sign, that is resistance on passive dorsiflexion of the foot. We have Moses sign, that is pain on applying pressure over the calf. Then we have Pratt sign, which is a pain on squeezing the calf. We have phlegmasia alba dolens. It is the white painful leg, and it is due to obstruction of the main venous trunk, but with patent collaterals. Then we have phlegmasia caerulea dolens. It is a painful blue leg, and it is due to obstruction of both the main venous supply as well as the collaterals. Diagnosis is made by duplex scan, and for treatment we give anticoagulants to the patient, and drug of choice is the IV heparin. We give IV heparin 10,000 units IV bolus, and with continuous infusion of 30,000 to 45,000 units per day. It is given for 5 days along with warfarin. The dose is 10 milligrams BD, and the dose adjustment is required from 3rd day onwards. And for monitoring of heparin, we use APTT, the normal values of which are 1.5 to 2.5, and for monitoring of warfarin we use INR, the normal values of which are 2 to 3.